Tame Salam. Role number 87. Anthelmintics. Anthelmintics are drugs used in the treatment of infestation with helminths in the intestinal tract or tissue of the body. Anthelmintics that kill worms are called wormicides, and those that helps to expel the worms are called vermifuges. Drugs for the treatment of helminthiasis are mebendazole, albendazole, niclosamide, ivermectin, parental palmate, albendazole, levamisole, praziquantel, and diethylcarbamazine citrate. So the first drug is mebendazole. Mebendazole is a benzimidazole and has a broad spectrum of anthelmintic activity. It binds to beta-tubulin and inhibits microtubule polymerization. It also blocks glucose transport into the parasites. So as a result, intestinal parasites are immobilized or die slowly. Pharmacokinetics. Mebendazole is administered orally, poorly absorbed from GI tract, highly bound to plasma protein and metabolized in liver. Most of the oral dose is excreted in feces. Adverse effect. Systemic toxicity of mebendazole is low because of its poor absorption. It is well tolerated and rarely cause GI side effect like anorexia, nausea, vomiting, diarrhea. Occasionally, it may cause skin rashes, itching, drug fever, etc. It is contraindicated in pregnancy and children younger than 1 year. Uses. Mebendazole is highly effective against intestinal nematodes like roundworm, hookworm, whipworm, pinworm. It is more effective than albendazole in trichuriasis. Dose and administration. Mebendazole 100 mg orally twice a day for 3 days. It does not require fasting or purging, is well tolerated and is relatively cheap. Second drug is albendazole. It is also benzimidazole and has a broad spectrum of anthelmintic activity. The mechanism of action is similar to that of mebendazole. Pharmacokinetics. Albendazole is given orally. It is erratically absorbed. Fatty food increase its absorption. It is metabolized in liver. It produces an active metabolite, albendazole sulfoxide, which is widely distributed into various tissue, including hydrated cyst. Albendazole is preferred to mebendazole in the treatment of hydrated disease. Adverse effect. Albendazole is very well tolerated. The side effects are rare, but can cause nausea, vomiting, diarrhea, and epigastric distress. During long-term therapy, it may cause hepatic dysfunction, headache, dizziness, fever, weakness, loss of hair, and neutropenia. Dose and administration. It can be taken as a single oral dose of 400 mg for an adult and children older than 2 years, and as a 200 mg single dose for children between 1 and 2 years of age. It is taken at any time of the day, does not require fasting or purging, and side effects are rare. Its uses. First, nematodes. Albendazole is highly effective against intestinal nematodes like roundworm, hookworm, whipworm, and also in mixed worm infestation. It is more effective than mebendazole in trichinosis. Second is neurocysticercosis. Both albendazole and praziquantel are highly effective in neurocysticercosis, but albendazole is preferred to praziquantel because of the following reason: that it is cheaper, duration of treatment is shorter, it reaches a high concentration in brain and CSF, it is less toxic and better tolerated. Glucocorticoid increases plasma level of albendazole sulfoxide but decrease plasma praziquantel level. Third is hydrated disease. The hydrated cyst surgically resection is the treatment of choice, but albendazole is the drug of choice for medical therapy. Fourth one is filariasis. Single dose of albendazole is given with diethylcarbamazine citrate or ivermectin in the treatment of lymphatic filariasis. Albendazole has adjuvant value. The third drug is thiabendazole. benzimidazole. Thiabendazole has a broad spectrum of anthelmintic activity and is effective against most of the nematodes. The mechanism of action is similar to that of the mebendazole and albendazole. It is rarely used because of high incidence of toxicity. Next one is piperazine. It is effective against roundworm and pinworm. It causes flaccid paralysis of worm that are later expelled by peristaltic movement. It is partially absorbed and most of the drug is excreted unchanged in urine. Adverse effect. The adverse effect include nausea, vomiting, abdominal pain, skin rashes, and dizziness. It is safe for use during pregnancy. Next one is levamisole. It is effective against roundworm and hookworm infestation. It is an immunomodulator. It is also used as an adjunct in rheumatoid arthritis and cancer chemotherapy. The next one is parental pomade. It is highly effective for the treatment of roundworm, pinworm, and hookworm infestation. Occidental pomade is effective in trichuriasis. Its mechanism of action is parental pomade, which inhibits choline esterase in worms, which leads to increase in acetylcholine concentration. Also, it is stimulate nicotine receptors in the worm. As a result, persistent depolarization occurs and spastic paralysis occurs, and the worms are expelled. Pharmacokinetics. Parental pomade is given orally but absorbed poorly. About 80 to 90% of oral dose is excreted in feces. Dose and administration. It can be taken as single oral dose of 11 mg per kg. Does not require fasting or purging. Is well tolerated and is relatively cheap. Its adverse effect these includes nausea, vomiting, diarrhea, headache, dizziness, skin rashes, and fever. It is contraindicated in infants. The next one is diethylcarbamazine citrate. Diethylcarbamazine is the most effective drug used in the treatment of filariasis and tropical eosinophilia caused by Wuchereria bancrofti and Brugia malai. Diethylcarbamazine citrate is available as a citrate salt. It acts mainly on microfilari, but the adult worms are killed slowly, only on longer term treatment. Diethylcarbamazine citrate damages the microfilarial membrane or structure so that they are destroyed by host defense. Pharmacokinetics. It is well absorbed from the GI tract, widely distributed in the body, metabolized in the liver, and excreted in urine. Diethylcarbamazine citrate is safe for use during pregnancy. Its adverse effect. First, drug-induced effect. This includes anorexia, nausea, vomiting, headache, and dizziness. Second, parasite-induced reaction. These are due to the release of protein from dying parasites. In onchocerciasis, diethylcarbamazine produces a severe reaction which is termed Mazzotti reaction. It is characterized by severe itching, fever, skin rashes, nausea, vomiting, headache, joint pain, lymphadenitis, keratitis, and uveitis. Hence, diethylcarbamazine citrate is not recommended in onchocerciasis. In Wuchereria bancrofti, the reaction is usually mild. This can be minimized by administering H1 blockers. The reaction is treated with H1 blockers and glucocorticoids. Uses. First, filariasis. Diethylcarbamazine is the drug of choice for the treatment of filariasis due to the Wuchereria bancrofti and Brugia malai. It is administered orally 6 mg per kg per day in 3 divided dose of 3 weeks. Addiction of single dose of albendazole 400 mg to diethylcarbamazine produces sustained microfilaricidal effect. Diethylcarbamazine with albendazole is used to reduce transmission of filariasis. Second is tropical eosinophilia. It is treated with diethylcarbamazine 100 mg thrice a day for 3 weeks. Antihistaminics and glucocorticoids may be required to control allergic reactions. The next drug is ivermectin. It is the drug of choice in onchocerciasis and strongyloidiasis. It is effective against microfilaria of Wuchereria bancrofti and Brugge-Malai. The mechanism of actions is ivermectin, which activates glutamate gated chloride channel and also increase GABA transmission in worm, which leads to hyperpolarization and paralysis of worm, and ultimately death or the phagocytosis of worms occur. Pharmacokinetics. It is given orally, rapidly absorbed, widely distributed to various tissues, metabolized in liver, and excreted mainly in feces. So uses first, ivermectin is the drug of choice for onchocerciasis. It kills microfilariae, but little effect on adult worms. It relieves pruritus and skin disease. Second, it is also very effective in strongyloidiasis, ascariasis, and cutaneous larva migraines. Third one is it is usually orally in the treatment of scabies and pediculosis. Fourth, it is useful for mass chemotherapy of filariasis as single annual dose along with the albendazole. Adverse effect: they are itching, skin rashes, edema, headache, fever, muscle and joint pain. It can cause Mazotti reaction during treatment of filariasis. It is contraindicated in pregnancy and children. The next drug is praziquantel. Praziquantel is effective in the treatment of trematodes and cystodes, but not in nematodes. Mechanism of action: the praziquantel increases the influx of calcium ions into the tegument, which increase muscular contraction and spastic paralysis at a higher concentration. The damage tegumented and death of the parasite occur. Pharmacokinetics: praziquantel is readily absorbed after oral administration, undergoes extensive first-pass metabolism in the liver, is highly bound to plasma protein, crosses the blood-brain barrier, and is excreted mainly in urine. Adverse effect: the most common side effect is dizziness. Other side effects are nausea, vomiting, abdominal discomfort, headache, drowsiness, skin rashes, itching, joint pain. Uses: first is schistosomiasis. Praziquantel is the drug of choice for all species of schistosomas. Praziquantel 40 mg per kg, single oral dose usually produce a high cure rate. It is well tolerated and reasonably cheap. Second is tapeworm infestation. A single oral dose of praziquantel gives a very high cure rate in all tapeworm infestation. Third is neurocysticercosis. It is alternative agent for neurocysticercosis. Praziquantel is contraindicated in pregnancy and ocular cysticercosis. Next drug is niclosamide. It is the second drug of choice for Tinea saginata, D. latum, and H. nana. It is poorly absorbed from the GI tract. It inhibits oxidative phosphorylation in the mitochondria of the parasite and rapidly kills adult worms, but not the ova. It is given orally in the form of chewable tablets. Its adverse effects: niclose might produce few minor side effects. They are nausea, vomiting, diarrhea, headache, skin rashes, itching, and abdominal discomfort.